The debate about police reform has divided many communities, but there is widespread agreement that sending mental health professionals to help people in crisis with or without police backup is a good idea. One study found people with untreated mental illness are 16 times more likely to be killed during an encounter with officers. Jeff Pegues takes us inside one Colorado community's experiment with alternative ways to handle mental health crises.
Across the country, police officers are increasingly responding to mental health-related calls that don't always require an armed response.
We received a call from your school today. I just wanted to touch base.
Aurora, Colorado has a team of health professionals separate from the police who are now dispatched to some emergency calls.
There were some statements about suicide that were made to a friend yesterday.
Especially when it's determined that an armed officer is not needed.
We're just gonna stop by and check in with her.
So they got a 911 call, and that's why we're here in this neighborhood. It came from a school counselor concerned about the safety of a student. We rode along with his mobile response team as it traveled through the city's snow-covered streets. Once they arrived in the area, they reached out to the student.
I spoke with mom and spoke with kiddo, and we don't have any concerns for safety at this time.
In the past, police would have responded to the call. Sergeant Aaron Bunch acknowledges that there are limits to what police officers are trained to do.
So we have calls for people that are in mental health crisis every day. Police officers are trained to do a lot of things. What they don't have are master's degrees in social work, clinical psychology, things like that.
Courtney Tassin, who is the response team's program manager, says there were more than 800 mental health-related calls for help here during a recent 4-month period. The fact that you're not armed, the fact that you're not wearing a uniform, do you think that helps in some of these situations?
I think so. So we always focus on what's least restrictive. How do we keep from further traumatizing this person who's already in a very vulnerable state?
Thousands of police departments in America are now using similar units to respond to people experiencing a mental health crisis.
So you're at this location now when the person is threatening you?
In Washington, D.C., 911 calls are screened to determine if mental health professionals are the more suitable response.
What was the threat?
To prevent a mental health crisis from escalating into a fatal confrontation. For CBS Mornings, Jeff Pegues, Aurora, Colorado.
Really smart, but it's got to fund from. There's got to find some funding somewhere for units like this.
Yeah. When I was young, I was fascinated by the negotiator, the guy or woman that would go in and talk down the criminal. As I got older, I realized we need negotiators when it comes to dealing with those that are dealing with mental illness or having an episode, because they're knowledgeable in that space. And some of these officers, like he said, they're not equipped mentally to handle that situation.
And also, cops sign up to fight criminals and crime.
Right.
They don't want to deal with people in mental health crises. That's a different task.
Yeah.
It's a good way to try to avoid some of what we've seen before.
Right.